Imagine holding your hand in a clenched white knuckle fist. Not just for like a minute or an hour, but for days.
Or weeks.
Yeah, weeks, maybe even years. Welcome to the deep dive. I'm so glad you're here with us today because we are tackling a massive silent epidemic that most people don't even realize they're dealing with.
Right. It's incredibly common, but almost entirely ignored.
Exactly, because when we talk about health, fitness, and our bodies today, there is this undeniable, almost, culturally ingrained obsession with
Oh,
tightness.
for sure. Toning, strengthening, engaging the core.
We are constantly told to build up our physical armor, right? And it feels incredibly intuitive. If a part of your body isn't working right, the default assumption is just that it must be weak and it needs to be tightened.
I mean, it's a completely understandable mindset. But it's actually, well, it's a bit more insidious than just wanting to be strong.
Okay.
Because we've essentially equated physical tension with health and discipline. And that leads to a massive blind spot, especially when we look at the complex musculature that literally holds our internal organs inside our body.
Which brings us to our mission for today's deep dive. We are going to bust the biggest, most pervasive myth in pelvic health.
It is a huge one.
It really is. Almost everyone has been told at some point that to fix pelvic issues, whether you're dealing with leaking or pain or just discomfort, you just need to do more Kegels.
Right. You just need to build strength.
But we are asking a completely counterintuitive question today based on a frankly fascinating stack of medical research. And that question is, can pelvic floor relaxation actually be more important than strengthening?
And for a huge portion of the population, the evidence heavily suggests the answer is a resounding yes. It's really a paradigm shift in how we treat the human body.
We have an incredible stack of sources guiding us today, too. We're looking at official, highly rigorous medical guidelines from NICE, that's the National Institute for Health and Care Excellence, along with the Royal College of Obstetricians and Gynecologists.
Which is top-tier clinical data.
Yeah, the gold standard. We've also pulled clinical insights from the Cleveland Clinic and some really eye-opening physical therapy data that completely changes how we understand muscle mechanics.
And we should probably emphasize right out of the gate that this is far from a niche medical topic.
Ah.
Pelvic floor dysfunction is just staggering in its reach.
It's everywhere.
It really is. The Royal College of Obstetricians and Gynecologists notes that chronic pelvic pain affects roughly 1 in 6 women.
Wow. 1 in 6?
Yeah, but the data shows it goes way beyond that. It affects men, it affects young people who have never had children, it affects elite athletes. This deep dive is really about helping you rethink how you carry tension in your own body,
Right. Understanding the hidden physiological cost of just never fully letting go.
Yep.
Okay, let's unpack this. To really understand what's happening, we need to define the term that pops up over and over in these clinical sources. And that term is a hypertonic pelvic floor.
Right, hypertonic.
Basically, it means your pelvic floor muscles are in a constant, unbroken state of contraction. They're in spasm. They have essentially forgotten how to return to a neutral state.
Yeah, because every muscle in your body has a baseline resting tone. I mean, even when you're just lying on the couch doing absolutely nothing, there's a slight natural tension keeping your body intact.
You don't just fall apart.
Right. But in a hypertonic pelvic floor, that baseline resting tone is dialed up to an 11 permanently. The muscles are constantly on guard.
Just locked up.
Locked up. And because your pelvic floor isn't just one muscle, it's this complex, interwoven hammock of muscles, ligaments, and nerves at the base of your pelvis. That constant rigid tension disrupts a whole host of bodily functions that basically rely on flexibility.
The symptoms are incredibly diverse, too, which probably explains why patients get bounced around from specialist to specialist, constantly misdiagnosed.
Oh, absolutely.
According to the Cleveland Clinic, the presentation can be really baffling. We're talking about urinary frequency, which is that maddening feeling where you urgently, desperately need to go to the bathroom, but when you get there, it's just a dribble.
Or severe chronic constipation.
Unexplained lower back pain, dyspareunia, which is the medical term for pain during sex.
And what's fascinating here is the presentation in men is particularly striking, and it's often misdiagnosed as prostate issues.
Really? Like, what does it feel like?
Well, many men with a hypertonic pelvic floor describe a very specific sensation. It feels like they're literally sitting on a golf ball all day long.
Ouch. That sounds awful.
Yeah, there's this constant, deep, localized ache or pressure in the perineum that just won't go away.
Now, if you are listening to this right now and you occasionally leak urine when you sneeze or laugh, you might be thinking, wait a minute, leaking feels like a loose valve.
Right.
That feels like a weakness that needs to be tightened up, not relaxed. It's incredibly counterintuitive to think that tension could cause a leak.
It is probably the most logical assumption you could make. And it's the exact reason millions of people get trapped in a cycle of worsening symptoms.
So why does it happen?
To understand why a tight muscle causes leaking, we have to look at what physiotherapists call the length-tension relationship.
Hmm.
In order for any muscle in your body to generate a good amount of power, it needs a full dynamic range of motion.
It needs room to move.
Exactly. It needs the space to stretch out and then the runway to forcefully contract.
So if a muscle is sitting in a permanently shortened, tight state throughout the day, it physically has no runway left.
Precisely. It cannot produce effective power when you suddenly need it to.
Let's go back to that analogy of holding your hand in a tight, clenched fist for a month. Like if I throw a baseball at your head and your hand is already clenched as tight as it can go, you aren't going to be able to catch that ball.
No, you just get hit by the baseball.
Right. Your hand isn't strong in that state. It is exhausted, sore, and completely dysfunctional.
That's a perfect way to look at it. The clinical literature puts it very bluntly, actually.
Mhm.
A tight muscle is a weak muscle. Your pelvic floor needs to be able to act like a trampoline.
Okay, trampoline.
Right. When you sneeze or cough or jump, there is a sudden massive spike of downward pressure in your abdomen. A healthy pelvic floor absorbs that pressure by dipping slightly and then immediately springing back up, clamping down on the urethra to prevent a leak.
But if your pelvic floor is already clenched tight like that fist, it's rigid.
Exactly. It can't absorb the shock, and it can't clamp down any further. The pressure just blows right past it, and you leak.
Wow. That completely flips the script on how we view weakness in the body. If your muscles are exhausted from being chronically tight, the last thing they need is a workout.
It's the absolute last thing they need.
Now, culturally, we tend to blame pretty much all pelvic floor issues entirely on pregnancy and childbirth. And obviously, the trauma from vaginal tears, episiotomies, or C-sections is a major trigger. The body literally tenses up to protect damaged tissue.
Which is a natural biological response.
But the physical therapy data reveals a much broader landscape here. This affects people who have never been pregnant, and it affects men. The triggers are everywhere.
Yeah, we see a huge range of structural and behavioral triggers that have absolutely nothing to do with childbirth. Let's look at structural compensation, for instance.
Like posture issues.
Posture or injuries. Say you have a knee injury or chronic lower back pain. Your body's incredibly smart, right? It will unconsciously recruit neighboring muscle groups to help stabilize your spine or your gait.
Oh, I see.
Very often, the pelvic floor muscles get drafted into working overtime to support your back, leading to chronic tension.
And posture plays a massive role here, too. Like if you're standing up right now, try sticking your tailbone out behind you, almost like a duck, so your lower back arches deeply. That is called an anterior pelvic tilt.
Yeah, a lot of people walk around like that.
You can literally feel the baseline tension in your pelvis and lower back shift just by doing that. If you walk around like that all day, you are putting a constant mechanical strain on that pelvic hammock.
And then we get into behavioral habits, specifically in the bathroom. This is where modern convenience actually works against our biology.
Oh, bathroom habits. This is a big one in the sources.
It really is. The habit of delaying urination because, you're stuck in back-to-back meetings or you don't want to use a public restroom, it forces those muscles to stay clamped shut far longer than they were designed to.
And the sources bring up hover peeing. And the mechanics of this are wild.
The worst.
Yeah, like when you go into a public restroom and you don't want to touch the seat, so you hover or squat just a few inches above it.
Hovering is one of the worst things you can do for pelvic floor health. Think about the biomechanics of that position. To keep yourself suspended above the toilet, your quadriceps, your glutes, and your pelvic floor muscles are all actively, forcefully engaged to hold your body weight up.
Right, because you're essentially doing a wall sit without a wall.
Exactly. They are entirely contracted. But at the exact same moment, you are trying to empty your bladder. So you are forcing your bladder to push urine past a rigid, clenched wall of muscle.
That sounds terrible for you.
It is. Over time, that actually trains the pelvic floor to remain tense and confused during functions where it absolutely, biologically needs to be relaxed.
That mechanical conflict makes perfect sense. But here's where it gets really interesting. The clinical data goes even deeper than bad posture or bathroom habits. It dives into the psychological connection.
Yeah, the mind-body link here is undeniable.
I mean, how exactly does an abstract emotion like anxiety or chronic stress or past trauma physically lock up the muscles at the base of our pelvis?
It all comes down to our autonomic nervous system and primitive survival instincts that we share with most mammals. When we experience stress, anxiety, or trauma, our sympathetic nervous system triggers the famous fight or flight response.
Right, adrenaline pumping, all of that.
Exactly. This is designed to be a temporary state to help you escape a predator. Blood rushes to your limbs, your heart rate spikes, and your muscles brace for impact.
But in modern life, we aren't running from predators. We are sitting in traffic, reading stressful emails, or doom scrolling the news on our phones.
Yeah, the threats are invisible now.
Many of us are living in a chronic, unbroken state of low-grade fight or flight. We never process the stress cycle.
And the physical manifestation of that unreleased stress is profound. The data uses a really evocative biological analogy here. Think of a scared puppy.
A scared puppy.
Yeah. When a dog is terrified or anticipates pain, what is its immediate involuntary reflex? It tucks its tail deeply between its legs.
Oh, wow. Yeah, it does.
Humans possess the exact same primitive reflex. During moments of stress, fear, or anxiety, we reflexively tuck our tailbone. Because the deep pelvic floor muscles, like the pubococcygeus, attach directly to the tailbone, this subconscious tucking physically shortens and tightens those muscles.
That is fascinating.
It is an involuntary biological guarding mechanism.
So our pelvis is literally bracing for an impact that never comes. The muscles are locked in a defensive crouch all day.
Exactly. And this protective guarding doesn't just happen with emotional stress. It happens in response to chronic internal pains.
Right. What kind of pain?
The clinical guidelines highlight conditions like endometriosis, where tissue similar to the uterine lining grows outside the uterus, causing severe internal inflammation and lesions, or irritable bowel syndrome, which causes chronic cramping.
Right.
The nervous system senses this intense internal pain and reflexively clenches the surrounding pelvic floor muscles to protect the area, acting like an internal splint.
So it's trying to help.
It's trying to help, but that secondary muscle tension ends up causing a whole new layer of pain that persists long after the original flare-up of endometriosis or IBS has passed.
If our bodies are instinctively locking up to protect us from pain or stress, it completely changes how we should treat that pain. I mean, if someone takes that scared puppy, pelvic floor, a muscle that is acting like a clenched fist, exhausted and bracing for impact, and tries to do a traditional strengthening Kegel, the results are going to be disastrous.
It's essentially throwing gasoline on a fire. You're taking a muscle that is already in a state of spasm, starved for oxygen because the blood vessels are constricted by the tension, and you are aggressively commanding it to clench even harder.
It just sounds painful.
It will actively make your pain, your incontinence, and your dysfunction worse.
I want to push back on this, though, because we promised to look at the official guidelines, and I want to make sure we aren't misinterpreting the medical establishment here.
Sure, go for it.
I'm looking right at the official text from the NICE guidelines, the National Institute for Health and Care Excellence, and they explicitly state, I'll just quote it, women with stress or mixed urinary incontinence should be offered a supervised pelvic floor muscle training program comprising at least 8 contractions performed 3 times per day.
Right.
That is quite literally a prescription for Kegels. It sounds like we are flat out contradicting official medical advice.
If we connect this to the bigger picture, it makes sense. But I agree, on the surface, it absolutely looks like a contradiction. But when we look at the comprehensive framework of those guidelines, the conflict disappears.
How so?
It is all about the order of operations and the absolute necessity of proper clinical assessment. Yes, the NICE guidelines advocate for strengthening, but they strictly mandate that any supervised program must first involve assessing the woman's ability to perform a pelvic floor contraction and relaxation.
Huh. So the relaxation is a prerequisite in the actual medical literature.
It's the critical filter. Strengthening is highly effective, but only for a hypotonic pelvic floor, meaning one that is genuinely weak, lengthened, and lacks tone.
Okay, that makes sense.
Right. But for a hypertonic, tight floor, the patient must practice what physical therapists call downtraining first. You simply cannot build strength or power in a muscle until you have restored its normal resting baseline tone. The guidelines assume a trained professional has done an internal assessment to determine if the muscle needs to be actively relaxed before anyone starts counting out reps of contractions.
That makes the concept of downtraining the master key here. But, if you're listening to this, how do you actually do that? Telling someone to consciously relax a muscle they've unconsciously guarded their entire life Feels a bit like telling them to wiggle their ears.
Yeah, exactly.
We don't have a conscious connection to those muscles. We don't know where the switch is to turn them off.
This raises an important question, which is how do we relearn muscle control in an area of the body we've ignored? The clinical literature is clear that this requires a multidisciplinary approach.
So no quick fixes.
No, this isn't a quick fix you can solve with an app in a week. It often involves pelvic floor, physical therapists, pain specialists, and sometimes even psychotherapists to address the underlying trauma or anxiety that is driving the nervous system to clench in the first place.
But the sources do outline specific, actionable biomechanical techniques to start that down training process, right?
Yes, definitely.
And the most foundational technique across almost all the literature is diaphragmatic breathing, which is often called belly breathing. Let's break down the mechanics of why changing how air enters your lungs changes the tension in your pelvis.
It comes down to intra-abdominal pressure. Your diaphragm is a large dome-shaped muscle that sits horizontally right under your rib cage. Your pelvic floor sits horizontally at the bottom of your pelvis.
Why?
They operate together in a synchronized system, like a piston inside an engine.
So when you take a slow, deep breath and you let your belly expand instead of your chest, your diaphragm actively pushes downward into your abdominal cavity.
Because it has to push your internal organs down to make room for your inflating lungs.
Got it. And that downward pressure pushes directly onto the pelvic floor. Because it's a flexible hammock, the pelvic floor naturally drops, stretches, and lengthens to accommodate that pressure.
Then, as you exhale, the diaphragm moves back up and the pelvic floor gently recoils to its resting position. By consciously practicing belly breathing for just a few minutes a day, you are mechanically forcing the pelvic floor to move through a relaxed, elongated range of motion.
So you're literally breathing into your pelvis.
You are using your own breath to gently stretch a muscle from the inside out.
You're overriding the clenched fist just by altering your breathing mechanics. That is incredible. The sources also mention pairing this breath work with gentle hip-opening stretches adapted from yoga.
Yes, very effective.
Poses like child's pose, where you kneel on the floor, sit back on your heels, and stretch your arms forward. Or happy baby, where you lie on your back and hold your feet. These specific angles mechanically open the pelvic outlet, spreading the sits bones apart to give those tight muscles physical room to widen.
It's all about creating space. And just as importantly, the experts emphasize that you cannot heal a hypertonic pelvic floor if you don't stop the daily habits that are causing the tension.
So the hover peeing has to go.
You have to stop the hover peeing, you have to sit fully on the toilet seat and let your glutes completely relax, and crucially, you have to break the habit of constantly sucking in your stomach.
The chronic stomach gripping, this is huge.
It's so common.
Whether it's for aesthetic reasons like trying to look thinner in clothes or just an unconscious habit born of stress, so many people walk around from morning until night with their upper abdominal muscles rigidly pulled in.
Think about the physics of that. If you are constantly clamping down on the top of your abdomen, you are creating constant, unrelenting downward pressure on your internal organs.
And that pressure has nowhere to go but down onto the pelvic floor.
Exactly. You are effectively putting a heavy weight on that hammock 24 hours a day, making it biologically impossible for those muscles to ever achieve their resting tone.
Now, for severe cases where the spasm is deeply entrenched, the clinical data mentions some fascinating medical interventions that go beyond just breathing and stretches.
Yeah, modern pelvic therapy is amazing.
They use biofeedback, which is brilliant. They place electrical sensors on the pelvic floor muscles that measure the electrical activity of the tension, and they connect it to a monitor.
Right, so the patient can literally look at a screen and see a graph of their unconscious muscle tension.
And when they try to relax, they get real-time visual proof of whether the muscle is actually letting go or not. It makes the invisible visible.
We also see treatments like theal massage, which involves a specialized physical therapist doing manual internal release of the muscles. They find the specific microscopic trigger points where the muscle fibers are locked together and manually apply pressure to force them to unbind.
Sounds intense.
It can be. And for extreme, intractable spasms, doctors will even use prescription muscle relaxers or inject Botox directly into the pelvic floor.
Wait, Botox,
Yeah.
the same stuff used for wrinkles.
Exactly the same neurotoxin, yeah. Botox works by temporarily blocking the chemical signals from the nerves that tell the muscles to contract.
Wow.
By paralyzing those specific spasming fibers in the pelvic floor, it breaks the cycle of chronic tension, giving the muscle a forced reset period to heal and lengthen while the physical therapy takes effect.
It really highlights just how fiercely these muscles can lock up and why treating this condition requires such targeted, deliberate, and sometimes really intensive care. It's not a matter of just trying harder, it's about fundamentally rewiring how your brain communicates with your pelvis.
It's unlearning a bad habit.
Exactly. I love thinking about this whole process like unclenching your jaw. You know that feeling when you're sitting at your desk, intensely focused on a problem or stressed out, and you have absolutely no idea your jaw is locked tight?
Oh yeah, your teeth are just grinding.
Yeah. And it isn't until you consciously bring your attention to your face, drop your shoulders, and actively let your jaw fall open that you realize how much tension you are holding. Unclenching your pelvis is the exact same thing. It is an active, mindful practice of letting go.
That analogy captures the daily reality of this perfectly. It requires mindfulness. You have to be willing to interrogate your own body and consciously break physical habits that you've likely held for decades.
So what does this all mean? If we step back and look at everything we've explored today, from the rigid guidelines of clinical bodies to the physics of the diaphragm piston down to the scared puppy reflex hardwired into our nervous system, the biggest takeaway is that achieving genuine functional pelvic health isn't about constant tension.
Definitely not.
It's not about grinding strength, tightening the bolts until they stiff, and building armor. It is fundamentally about balance. It's about flexibility, range of motion, and giving your body permission to let go. So pay attention to your own body today. Notice if you're holding your breath while you answer a difficult email. Notice if you're hovering over a toilet in a coffee shop.
Or if your stomach is constantly sucked in.
Exactly. Your body might be carrying a defensive burden that it simply doesn't need to carry anymore.
And if we look even deeper into the implications of this research, it leaves us with a pretty profound question about the mind-body connection. We've established that our pelvic floors are essentially acting as physical sponges, absorbing our modern stress, our relentless anxiety, and our unaddressed trauma. If our bodies are keeping the score, what happens to us if our culture never teaches us how to actively let go? If society only ever celebrates the hustle, the tension, and the grind, will future generations simply accept chronic internal physical tension and all the resulting pain and dysfunction as the normal baseline for human existence? Learning to regulate your nervous system today and taking the time to literally breathe space into your pelvis might be the exact thing reshaping your physical foundation for tomorrow.